Hello everyone and welcome. Thank you all for coming along this evening. My name is Caroline Sargison and I am a nurse. I am a lecturer in nursing, but I'm also responsible for our recruitment and selection for nursing and midwifery. So what I want to do this evening is just give you a bit of a guide as to what it is you could be doing to prepare for your interviews and what it is we're looking for. I'll talk a little bit about the content of our interviews, but quite a lot of it will be about the preparation before your interview, the sort of things you could be focusing on in your preparation. We will touch a little bit on the mini multiple interviews, but that's not, we don't use those at Middlesex. And then a little bit about what the course will do to help you with your future career. Obviously, we will answer any questions that you may have, so do put those in chat. As Natalie said, I am one of the people that does interview you. So, you're going to get really good advice this evening. Okay, next slide, please. So before your interview, what sort of things should you be involved in? Depending on where you are, obviously there's lots of advice and support in preparing your UCAS application and writing your personal statement. And I'm sure you've had some useful hints and tips from UCAS, from your college or school, and also from guides here at the university. But what you really need to think about when you're writing your personal statement is if you're going to tell us something, then think about, so what? Why is that important? Why is it relevant? What do you want us to know about you? And when you do put your UCAS form in, please make sure you include everything, because you can get rejected quite quickly if you haven't put your entry requirements in, which is the next slide. So some of you may be wondering what we are looking for. At the moment, we are asking for 112 UCAS tariff points. So for A levels, that means 2 Bs and a C. For the BTEC, that means distinction, merit. And for access students, we're looking for 60 credits with merits and above at level 3. We do need you to have your GCSEs in maths and English. We don't actually ask for science. If you have science, that's great, but you won't get rejected if you don't have science at shortlisting. So we need, if you're doing GCSEs, that's grade 4 or higher, and we do accept functional skills at level 2 for nursing and midwifery. Also, if you're studying your access course and you have numeracy or literacy units within your access, we will accept those. So once you're shortlisted, you will then be invited to attend an interview. And the interview panel will consist of a member of the academic staff. We usually have a clinician from one of our partnership trusts and a service user. Some of you may be asking about where we send our students. As you may be aware, all nursing and midwifery students have 50% practice, 50% theory within their program. Doesn't matter which university you go to, you will still be required to do 2,300 hours of theory and 2,300 hours of practice. We actually arrange your placements for you. You're not expected to do it. We sort your placements out, because at the end of your 3 years, we need to be able to show the NMC that you've completed the required number of clinical hours. So if you think about Middlesex University, our main campus is at Hendon, and that's where our teaching is usually, and our clinical skills. And then our placements are across the top of North London. So we start with the Royal Free, which is at Belsize Park. We have the Whittington, the North Mid, and then we have Barnet and Chase Farm. And then we have 2 mental health trusts, which are Barnet, Enfield and Haringey and Camden. We also have community trusts, the Orthopaedic Hospital at Stanmore, and some of the private hospitals. These are the same for midwifery, but we also have George's and Whipps Cross, but that's only midwifery. So it's fine to think about your travel to university, but what you need to be thinking about is the 50% of your time when you're working shifts, you're going to be in our hospitals. And you need to be able to think about getting there for 7 o'clock in the morning, or late shifts or night shifts. They're the areas that you need to think about, because university teaching offer doesn't start till 9:30, but your shifts will start early and they'll finish late. So that's, for example, that's 37.5-hour week, which is either 5 short shifts or possibly 2 to 3 long days when you're in clinical practice. So when you're thinking about the universities, think about the placements. Don't think about the campus. Think about where you're going to be going on placement. Next slide, please. So when we're talking about preparing for your interview, these are some of the areas that we would expect you to have considered. We will explore these in lots of ways. And what I want you to think about when you're coming for an interview is it's a conversation. We may be asking you questions, but we want to find out from you. So it's not just a matter of answering the question, it's about providing examples, telling us a bit more about you. And I want to start with knowledge and awareness of midwifery or your chosen field of nursing. So if you've got as far as an interview, we will assume that you know why you've decided to become a nurse or a midwife and what it is that interests you. So you can tell us about why you've chosen to be a nurse. Because like any job interview, if you go along to your interview and you cannot demonstrate that you really understand what you're taking on and you actually know what's involved in that area of nursing or being a midwife, we would be reluctant to take you on, because what we don't want is you getting halfway through your first or second year and discovering that you don't actually like it because it's not what you thought it was. So I've interviewed people who didn't know they'd be working shifts, who didn't know what it meant to look after somebody. So lots of you will tell me that you care for people, but nursing and midwifery are so much more than that. And that's some of the things I hope to explore with you in this session. So think very carefully about what you know about midwifery or what you know about adult nursing, child nursing, or mental health nursing, whatever it is that you've decided you'd like to study. So along with that goes the next one, which is about awareness of the challenges during the course. And I can tell you now that if anybody asks you about the challenges that you're going to be facing, the answer to that is never, there won't be any, or I can cope with them, because you don't know how you're going to feel when you're looking after somebody who's probably not going to get better. Or as a midwife, a midwifery student, you might be with a mother whose baby's not going to survive. These are things that would be challenging to anybody. And what we're not expecting you to say is, oh, I can cope with that. What we want to see is that you've thought about how you would cope with that, where you would gain your strength from, where you would get your support from. It may be that you are anxious about the academic aspect of the course, and there's nothing wrong with that, but you need to think about what's the university going to offer you to support you. And we'll support you very well, but we need you to show that you've thought about how you manage that. Lots of you who come to our interviews are studying and working and have family commitments or work commitments outside of that. Tell us how you manage that. Tell us how you cope at the moment. What sort of things do you do? Because that shows you've thought about it. You've thought about what the challenges will be. Personal awareness, empathy, and caring is very good. Think about what you're good at. What do people say you're good at? Why do people come to you and ask you things? Why do people like working with you? Your personal awareness, your empathy, your caring approach. What do people say when they talk about you? Do they say that you're always prepared to listen, that you're always prepared to help, that you're a good team person? These are things that, it's good to be able to talk about in your interview. Share these things with us. Some of you may have worked in hospitals or care homes or care settings. Some of you haven't. Some of the best people I've interviewed recently have been working in other areas such as retail or hospitality, and that's great experience. So don't dismiss things as not being part of hospital settings or care settings. Think about work experience. Think about if you've had placements as part of your program. What did you learn about working with other people? What did you learn about the workplace during that? Because these are all transferable skills to you as a student nurse or midwife. Obviously, we expect that you're going to be non-judgmental and have cultural awareness, because the NHS is a massive, diverse, fascinating team. And so will your 3 years training be. You'll be working with lots of different people, different backgrounds, different views from your own. Just because you don't agree with somebody doesn't mean you don't like them. You can fall out with people over what they believe, but it doesn't mean you don't like them. How do you manage those types of conflicts? How do you manage working with people who may think differently to you? Because you're going to meet a lot of them and you have to be able to manage that. One of the other issues that's key at the moment is understanding what some of the issues are in the NHS, and never more than at the current time, because we've seen that lots of nurses have been displaced and moved to other areas to work. We've seen children's nurses are now working in adult settings to help with COVID. And that's fantastic, the way the NHS has come together and worked as a team to deal with these issues. So you need to be constantly aware of what the changes are, what the challenges are. One of the things that's come out of the COVID is the risk factors. So we know that patients who are possibly BME or obese, have struggled and have been at high risk of dying through this. So you need to keep yourself up to date with what the issues are in the NHS at the moment. Next slide, please. So when you're in your interview, please try and relax. We're very nice. We're not there to catch you out. We're not trying to think of horrible trick questions. But lots of you sit down in front of us and tell us that you're passionate about wanting to be nurses or midwives. That's great. But then the next question we're going to ask you is why? Why are you passionate? What is it that's taken you to this point? Is it because you've been an inpatient yourself? Are you working alongside qualified nurses or midwives? What is it that's got you this far? You need to be able to explain your journey to us. Some of you might be working as healthcare assistants and want to take the next step to get a qualification. Absolutely fine. So to help you with that, we would strongly suggest that you look at some of the main nursing midwifery journals, such as the Nursing Standard, the British Journal of Midwifery, or the Practicing Midwife. One of the other things that's quite good is looking at other people's careers. The NHS careers site is particularly useful because people talk about how they've got to be where they are. For example, I've ended up teaching because I was a ward sister for many years and worked with students a lot. And when the opportunity came to transfer into education, I took it, and I've never regretted it. But other people's journeys can be quite helpful to you when you're thinking about your career. And again, as we talked a little bit about this before, about the political landscape, what sort of things might affect your profession? So we've seen a lot of changes in terms of staffing. So there's many more opportunities now for people to take on things like associate practitioners or nursing apprenticeships. That may well be coming towards midwifery soon. So, knowing what's going on out there will really help you with your own career decisions. Next slide, please. So again, some of these we've looked at, but we're going to explore in a bit more detail. So why would you make a good nurse or midwife? What is it about you? And I can tell you that the answer to that is never because I care, because you all care. All of us care for somebody, even if it's just ourselves. Why would you make a good nurse or midwife? And to answer that question, you need to look at some of the things that we are looking for. So quite a lot of you refer to the 6 C's in your interview. That's fine. But what is it about you? Why would you make a good nurse or midwife? Do you have good communication skills? And what's important in this is the first one after communication is listening, because people think they communicate very well. But if you're not listening, you're not communicating because you're not responding to what's required. And sometimes communication is only about listening. It's just letting somebody else talk and you listen and let them tell you how they're feeling or what they need or what they'd like you to do. Talking, obviously very important, but also recognizing the non-verbal signs. So sometimes it might be enough that you're just sat with somebody and letting them talk. Again, compassionate, caring, genuine people skills are really important. And I'm not dismissing those in any way at all. But the kindest, most caring people are not going to be any good to you if they don't know what they're doing. So lots of your family or friends will be compassionate, caring, empathetic while you're ill, have genuine people skills. And that's great in a nurse too. But we need more than just that. We also need you to be motivated, committed, and enthusiastic if possible. So what we mean by that is that you're taking on a 3-year program, 3 years of clinical practice, academic study, and we're there to support you and help you. But we need you to maintain your motivation and your commitment. There will be times when you think, have I made the right choice? Is this for me? And it might be you want to come and talk to one of us about that, and that's absolutely fine. That's what we're there for. But the motivation has to come from you. As I've said before, we need you to recognise and understand the people that you work with and the diversity that's around you, and make sure that we treat everybody equally with the same way that we'd wish to be treated. So it's the recognition and understanding of that. Team working is really important in the NHS because you're going to be working across many teams, not just nurses and midwives, but you're going to be working across multidisciplinary teams, which include doctors, therapists, social workers, pharmacists. It could be that you have more than one team that you're involved in. So, for example, you could have the teams that you work with in your academic work, like your module teams, and then you've got the teams when you go into placement. So knowing your place in a team, are you good? Are you one of those people that sits back and listens and analyzes things and then comes up with solutions? Are you somebody that leads? Do you like to be led? Knowing what you expect from a team is really important. And from that, are you one of those people that solves problems? I always recognized in my nursing career that I quite liked having problems to solve, because often with nursing, there's no right or wrong. There's just the best possible outcome. So you're weighing up all your solutions, and that comes from your clinical knowledge, your academic knowledge, your experience, and all these things come together when you work as part of a team and look at solving problems. And sometimes that helps you manage your stress, and recognizing that you're in a stressful situation, and problem solving can help you with that. We also need you to be reliable and dedicated and punctual. And that means being, if you have to be on the ward at 7 o'clock in the morning, you're on the ward at 7 o'clock in the morning, because other people will be waiting for you to come so they can hand over so they can go home. So obviously things happen, public transport and other issues, but you have to be someone that's known for their timekeeping, for being reliable, and for being dedicated. Because if you're out in clinical practice and you're persistently late, or you're off sick, or you're absent, then the wards are just going to say they don't want you. The other thing that we're looking for more and more in our students, because this is something that you're going to take on when you're a qualified nurse, is we're looking at those leadership and management skills, because nurses lead teams, nurses make decisions, nurses lead wards, community teams, and that's what we're looking for. And even your leadership skills as a student will be helping you to develop those. So by the end of your possibly by the second year, we might be looking to you to look after patients on your own with a group of other students or healthcare assistants. And that's when your leadership and management skills come in. So management skills could mean your own time management. It could mean management of your behavior. It could mean management of your workload. But these are all things that you've developed, and you have them, but you need to focus on them and think about, what are my management skills? And that comes into your team working as well, and your place in the team. The final one is something that we will start to help you with if you don't have it already, but starting to feel confident and inquisitive. And we all say there's no such thing as a stupid question. If you feel unable to ask questions, you need to find a way to get around that, because there will be things you don't understand. There will be things you need help with, and you need to be able to ask a question, because if you don't ask it at that time, the moment might pass and you don't get the opportunity again. So your confidence might be one-to-one, or it might be in a group, but we will help you develop those further. So we will be looking at all these types of things that you're going to be showing us and telling us about when you come to an interview. So if you're preparing for your interview, think about how you're going to get these messages across to us. So if we ask you a question at an interview, think about what sort of things you'd like me to know about you. How will you tell me that you've got good intuition, or you're a good team player? What examples can you give me? It's your time to talk to us, to tell us things. So don't just answer the question. Think about, could I get an example in here? Could I tell them about something I've done at college, or something I've done in a work placement that shows that I have these skills, or that I'm developing these skills? Okay, next slide, please. So from that, we talk about transferable skills. So your transferable skills can come from you as a person. They may come from studies that you've done at school or at college, your work experiences, your life experiences, and we will help you to develop these further through your academic work and also your clinical placements. So these are some of the things that we're looking at. One of the most difficult skills as a clinician can be delegating, because you need to think about whether you're delegating the right task to the right person at the right time. And you may feel this sometimes when you're in a work situation, that people give you things to do that either aren't much of a challenge, you can do them happily, or you think, is this actually my role? So along with delegation is the ability to say to somebody, actually, I don't know how to do that, or I've never done that before, or I might need some help with that. So not only will you be looking at delegation, you can also look at being delegated to, and think about what that means to you. Listening, we've talked about. Communication, again, communication is often the biggest problem in teams, because people are busy and they don't communicate properly, so things get missed or things get doubled up on. Whereas if you had good communication, honest and open communication, it can help everybody in their academic work and in their clinical placement. The next two are very important when we're talking about being the member of a profession, and that's being analytical and carrying out research. And analytical can sometimes just be as simple as, is this the best way to approach this problem? Or is there a better solution to this? And that then leads you either to look at the research that's already done, or as you progress through your career, carrying out that research yourself. So there is research included in your program. There isn't actually a module that focuses solely on research, but it underpins everything you do. And the reason it's so important is because we need people to use the best evidence to care for their patients. So it might be that you're looking at a particular type of wound, and the research that's been done will direct you to the best regime for how to care for that wound. And that what that means is it's not everybody trying out their pet theories. They're following specific guidance that's tried and tested, researched, and the evidence produced to help you with that. It's the same way, you know, about, you've probably seen about the development of the vaccine for COVID. We had all sorts of ideas from various people, such as sunlight and bleach. But actually what matters at the end is the research that's produced by the drug companies that they can back up with the evidence from their analysis and the work they've done. So that's a massively important part. And it might be you're looking at something you're doing in a particular area and thinking, there must be a better way to do this, so that you can go and carry out the research, you look at what the evidence is there, and it might be that leads you on to do a project of your own as you progress through your career. We've talked a bit about leadership and motivation and time management, and prioritization is quite an interesting one because we may well explore that with you at your interview. How do you manage your priorities? What are your priorities? How will you manage your time, and how will you prioritize what needs to be done? These are transferable skills that you're already doing. You already know what your priorities are, and you already know how you need to manage them. Whether you do that or not is another matter, but you know what your priorities are, and you know how good or not you are at time management. Next slide, please. And the next. Okay, we're going to show you a short film now, which includes our students who are going to give you further guidance on our interview process.
Hi and welcome to your 5-minute nursing and midwifery interviews video. I'm Sophie and I'm joined by Natalie and Rosie and one of our students who is going to support us.
In this video, we'll look at how you can become the most prepared for your interviews.
There are a variety of interview types that you might be asked to attend. In this video, we'll look at the panel and multiple mini interviews.
Firstly, what's the difference? Panel interview. You'll meet several representatives who work in different roles. They'll ask you a number of questions relating to your field of study. You'll meet clinical staff, academic staff, and service users.
For multi-mini interviews, you'll likely have 6 to 8 stations, which represent the different competencies you need to meet in order to be a successful nurse or midwife. You'll be given a different scenario per station and a time limit, and you'll need to work your way through each area, answering a question or undertaking an activity. We want to help you as much as possible. So let's go through the sorts of things you could be asked during both these interviews.
Hi there, my name is Abigail and I'm the course ambassador for nursing here at Middlesex University. This is such an important question for you to practice answering. Why do you want to be a nurse or a midwife? What is it about this profession that really interests you? For example, you can say, I have a caring heart and I show empathy to people around me. Do give an example on what you've done to show empathy to people around you, and how has this experience influenced your decision in making nursing as a career? Now it's time to look at how much you know and understand about the role. What are some of the challenges nurses might face, and what will you do to overcome these challenges? Do you understand what a nurse does from day to day, and what are some of the skills and experience that will help you to do this job? This is where you need to give a practical example on what you've done and the skills you've gained that will help you to do this job. This is where you show off your time management skills and how organized you are. Do give an example of when you've taken part in a project in school or maybe in your personal life where you manage yourself and others to achieve a goal. demonstrates a good team working skills. You will be doing this a lot when working as a nurse. Nursing is all about working in a team and supporting each other. Think about some examples where you work in a team to achieve team goals and why you think these skills are so important in nursing. Take a moment to think about this question. Why do you think nurses and midwives need to have good communication skills? As a nurse or a midwife, you will be working in a team, which includes doctors, physiotherapists, dietitians, and many other healthcare workers. It is very important that you are confident when you speak and also you are able to pass on information clearly and effectively. You need to show your interviewer that you've got these skills and evidence them with examples. You need to be able to tell your interviewer why you think equality and diversity is so important in this profession. How do you think your understanding of equality and diversity will help your approach as a nurse or a midwife? Demonstrate and explain what the meaning of equality and diversity is and give examples. For example, as a nurse or a midwife, you will be working with patients from different parts of the world with different needs, different wants, different desires, and etc. You still have to give your patient the best of care with no judgment regardless of where they are from. This session is a little bit easier. This is where you get to talk about any work experience you have undertaken in school or college that demonstrates your transferable skills, or any life event that you feel have prepared you for the professional roles that you are aspiring to. As a nurse or a midwife, you will find yourself in emotive and challenging situations, which sometimes might cause you to cry or even feel so upset. Your interviewer wants to know, do you have the skills and abilities to cope in situations like this? How would you manage situations like this? Do think back to a time where you found yourself in difficult time. This could be anger, distress, grief in you, or even in others. How did you react to this and how did you manage this?
Hi everyone. What I would say to you guys is, looking at what Abigail has just said on the video, if you scan there, if you've got a phone, you can scan that code, and we've got a practice interview nursing and midwifery booklet that will give you all of those sorts of questions, and then you can start to use it virtually yourself, give you some ideas where you can write all your ideas to follow up with what Caroline has just said there. And now we're just going to talk about what an MMI is. Here at Middlesex University, we don't offer this, but actually we just want to just explain what it is for you. A mini multiple interview is something that is where you will have 5 or 6 workstations. You'll have 4 to 6 minutes on each workstation and maybe a short written essay that you need to complete. And you will go to each workstation and be timed throughout that, and each workstation will represent something different and what they're looking for in the core values. There are some useful information here on the Nursing Midwifery Council website, the code, which is for caring, compassionate competencies, your communication and your courage and your commitment to the NHS core values, which again, Caroline has spoken about. And within the booklet, there is a section just right at the end where it gives you some examples of questions that you may get asked at a mini multiple interview, and again how you can prepare for that and what they're going to be assessing you on for that. But again, here at Middlesex, we don't offer that type of interview. Caroline?
Okay, there's some further useful links for you. People often ask about what sort of things they should be reading So we've got some videos there that you can click through and have a look at. One of the things you might be aware of here at Middlesex is our skills labs, where we have the virtual reality and the augmented reality. And that's a very good picture of it up there on the screen now. So our videos will show you a little bit about what that's like. And of course, we've been using that more and more with helping our students get ready for clinical practice and helping them develop the skills that they need. So there's some really useful insights there as to sort of things you'll be learning on the programme. Also, don't forget to look on our website, on the mdx.ac.uk website, which is at the top right there, because that shows you things like the modules you'll be studying. There's links to some of our student stories as well. So there's lots of useful information there as well.
Mm-hmm. And if you're thinking of applying for 2021 or 2022, we've got an NHS Careers Fair hosted by the university virtually on the 11th of March, where you'll be able to see lots of people from all of these professions, where they'll be able to answer all your questions. And there's a QR code there for that. Again, we will send you the recording afterwards with all of this information, so you'll be able to then download the QR code for that. And then following on from that, thank you for joining us this evening. We do have our next open day is on Saturday, 27th of February, and it's on from 11 till 3, I believe. All information again is on our website. If you want further information to be sent to you, we can do that. We also have our Unibuddy open this evening until 6:30, where you can get lots of information from our mission staff, international, student finance, UCAS, and personal statement. You will have an email with that information, but if you're able to see this presentation, there's the link there right now. And we're just going to, should we go through the questions now, Caroline?
Absolutely.
I'll ask the questions. And okay. So what is the difference between paediatric nursing and what are some valid reasons for wanting to do specifically children's nursing?
That's quite a difficult one, because obviously it's about what you would like to do. Remember, children's nursing is children and young people, so it's up to the age of 18. And you'll be looking after children with all sorts of different conditions. I would suggest, if you're not sure about paediatric nursing, go and do some research on it. Have a look at websites, read about what's involved in it. Think about, do you want to be a children's nurse? Would you like to work in education perhaps? Or teaching or working in nurseries with young children? You need to think about children's nursing. In my opinion, I'm an adult nurse. Children's nursing is the most difficult, because you've got children who are sick, and they're very sick sometimes, but also you've got their parents. And if you're a parent, you would know that it can be very scary if your child's unwell. So sometimes the parents need lots of support as well. So with all fields of nursing, you're looking after family, but I would suggest that in children's nursing, it's much more the whole package. Hope that helps. Anyway, next question.
Will we only have one interview?
You'll have one interview per university. So if you, depending on how many universities you apply to, if you've used all 5 choices, each university will have a different approach. But at Middlesex, we have no test. We only have one interview, and you get to choose. We will send you an invite to interview, and you get to book and choose when you'd like to be interviewed. At the moment, all our interviews are via Zoom. We're not inviting anybody into the university.
Okay, can I just ask, there's somebody that's raised their hand. I can't unmute you. Could you please put your question in the Q&A function, and then we'll be able to answer that for you. The next question is, I'm currently doing an access course. Some of our units are graded pass or fail. Will that affect my chance of getting into Middlesex?
No.
No. I'm applying for midwifery professional practice top-up. Does the interview also apply to them?
I'm assuming that you're already a registered midwife, and if you're applying for a CPD top-up, then no. If you're applying as a registered nurse to do the midwifery shortened programme, yes, you will be interviewed for that.
Mm-hmm. And the next question is, I want to join mental health nursing, but I don't include reference in my UCAS application. I'm am I going to be accepted?
We won't accept you without a reference. So if we do make you an offer, it will be conditional upon receiving a reference from your manager or from your academic advisor.
Okay, next question is for the Q&As. I would like to ask how the hospital placements get allocated. Do you consider where the students live and if they have children whilst allocating hospital placements?
We don't consider whether you have children because most of our students have children, so that's not unusual. We do consider where you live. So we try to look at postcodes and routes to the hospital. But we try to, that's the best I can say to you. But unfortunately, because we have so many students who do have children, then we can't be taking everyone into consideration, because some people have things like they have older parents they have to look after. So lots of people have other commitments in their lives as well.
Thank you. Will you be carrying out panel interviews with candidates?
Yes, we are at the moment. They've been going on since the beginning of January.
What if you're attending the webinar via your phone and you can't scan the code? Will the interview booklet be available elsewhere? Yes, it will be. We will send you a recording for it and you should be able to download it from there, no problem. And it is available on our website as well. Hello, I had my interview on Saturday. Do I need another interview?
No, one's enough. You should be hearing from us very soon.
Hello. Okay, done. Or is it one-to-one? Is it one-to-one interview? It will be 2 people, will it, Caroline, like a panel?
The panel has 2 people that will be talking to you via Zoom.
Thank you. How many years is the course, Carol?
It's 3 years.
Done. What's next? Is there better job opportunities when you go to do a master's degree in children's nursing?
I would say no, because not to begin with, because you may have a master's academically, but you don't have mastery of your clinical side. So it may save you time after you've qualified, because obviously you have your master's then, but it will take, you still need to get the clinical experience in. So it depends where you want to work. It depends what sort of things you're looking at. But if you are able to go straight on to do a master's instead of your first degree, then obviously you should go for that.
Thank you. How long is the interviews usually, Caroline?
They're usually around 20 minutes to half an hour, depending on what you've got to tell me.
Thank you. Can I have one interview one-to-one? You need to apply through UCAS, and then if you meet the criteria and you are shortlisted, then you'll be invited to interview. Is that okay?
Yeah.
Roughly how many questions would it be in a typical interview?
That's about 9 or 10.
Mm-hmm.
But there may be, maybe you've answered something, but they'd like to know more from you. Mm-hmm. So there may be questions within the questions, or maybe there's something in your UCAS personal statement that the panel find interesting, they'd like to know more about. So things like focusing on the number isn't helpful. It's about thinking about what you need to tell us.
And what would you do if you are unable to answer a patient's question?
I'm not sure what you mean about that, because
I'm thinking it's when they're on placement. If as a student, then you'll be asking your mentor to help you with the question that you've been asked if you're unable to answer it. That's the way I'm seeing it.
When you're surrounded by other staff, you'll be able to help and support you with things like that.
How long is it? Yeah, we've done that one. How long is the interview? We will do. No, at Middlesex we don't do MMIs. Other universities do. So you just need to look around, and they will be able to tell you how long they are if they offer them. My midwifery interview is next week. We'll be asked to fill out assessments.
No, we don't have any assessments. It's just an interview. The information, if you've booked onto an interview, then you will have had information sent to you about the interview. Everything you need to know is in the emails that we've sent to you. Mm-hmm. Are our placements based on where we live? As much as we can do, yes.
Are the interview based on one? We've already said that it's a panel interview and there'll be 2 people.
Yeah, it is a one-to-one interview, but it's a panel. Mm-hmm. The students no, you don't get to choose your trust. We have to allocate you. There's so many of you. We have to allocate the placements. Emma, I'm disabled and sometimes use a wheelchair. Emma, what you need to think about is when you're in clinical practice, it's 7.5 hours, or it could be 12 hours. Would you be able to manage that? Because we have to think about your safety and we have to think about your patient's safety. And if it's going to affect your ability to stand, I would suggest you either contact us and talk to us one-to-one rather than doing it in a forum. But you need to think about being on the wards, because sometimes, with the best will in the world, you know, things happen that you're involved in and it's not that difficult to get away from. And if you need to use your wheelchair, I'm not saying no, I'm just thinking it's a discussion that you need to have with us.
Thank you.
How many questions do we have to answer per interview? All of them. If you don't answer a question, you're not likely to get through your interview. Middlesex doesn't do a foundation course for nursing.
No. You said it's a 1 interview. How long is it? Okay, we've already discussed how long it is. It's about 15 to 20 minutes, and there'll be a panel of 2. I'm worried in regards to exams being cancelled and not having any grades due to the impact of COVID. How does it affect? You will get grades.
Yeah, you will be graded. Your school will let us know what your grades are.
Yeah.
We went through this last summer with the previous intake, and we were as flexible as we possibly could be. So, you know, this is a conversation you need to be having with your school, because you know, we can only react to the information that they provide us. But we did it last year and we can do it again this year.
We've given you lots and lots of tips and ideas to think about nursing interviews.
And go back and read the presentation again, or listen to the presentation again.
Yeah. We've answered that question.
Yep.
What are the best and worst parts of nursing?
Well, that's a difficult one, because it depends what you're good at and depends which area of nursing you're going into. And I would say that the worst part of any job is the people you work with, because if you work with a great team, it's fantastic. If it's not, then it can be challenging. Members of the public can be rude, patients can be challenging, but the best bit is that it's never boring. It is a really exciting career. There's lots of prospects for you. There's always be a job for you as a nurse. You never stop learning and you never stop developing. So it depends what you like doing, really.
Excellent. Please, what is the earliest time? If you're wanting to apply for this year, for September 21, you need to apply before the 29th of January, which is the UCAS deadline. Is the school open for international students putting in consideration for COVID pandemic?
We don't, for the professional programs, we don't accept international students who require a Tier 4 visa because of the restrictions on you once you finish the course, because the registration associated with nursing midwifery is for registration with the NMC in the UK, and that doesn't apply to our international students.
Mm-hmm. Thank you. How are lectures going to be done to be in 2021?
Well, at the moment, once we went into lockdown in March, we moved everything online, and students we've carried on with that for this intake. What we'd like to see, I think, is a sort of blended learning approach in 2021, because for some people, the online lecturing works really well and they enjoy it. For others, they like coming into the university and being part of the group. So we're entirely dependent on what the COVID situation is, people being vaccinated. We do bring students in for skills teaching and have carried on doing that, but that's under very safe conditions and full PPE. And obviously all our students have gone out into placement. So all the students are attending their placement at the moment, if they're able to. Obviously, if there's anybody who's vulnerable, then they're not. But we've tried to make sure that we're not disrupting your programme, because it's important that you get your qualification.
Thank you. Do you have any advice for mature learners returning to university?
No, because you know what to do. If you're returning to university, you've got all the ideas there because you've done it before. It's just about being organised. That's the best thing. Organise, make the most of everything that's available to you. And at Middlesex, we've got so many things, like, you know, all our textbooks are electronic, the library's open 24 hours a day, there's lots of support with learning. So make the most of everything that's available to you.
Thank you. Is there free parking on campus?
Ha, 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 ha. No, there's no free, it's North London, there's no parking, but we've got really good public transport links. There's a bus that stops right outside the university, and it's not the campus you need to worry about, it's your clinical placements, because that's where you need to be at 7 o'clock in the morning, and there definitely won't be any parking at hospital sites. And if there is, it's going to cost you a lot of money.
Thank you. Do mental health nursing students do the same placements as adult nursing students?
No, because mental health nursing students do mental health placements. They're
Okay.
very different.
There's somebody coming, they've called for an interview to try to book an interview, but there's no dates available at the moment.
But you haven't told me which field you're looking at, but I can tell you that I've spent most of today working with admissions, sorting out some new dates. So there should be dates coming out very soon.
Thank you. So we've already answered that question. How many questions? We've done that one. What is the special about mental health nursing that isn't in regular nursing?
I don't know what you mean by regular nursing.
Have a disabled child, and sometimes I can. How can I do that? What I would say to you is you need to ensure that you are able to support your studies as well as having children. I don't know what else to say.
With the nursing programme,
Yeah.
We have to show that you've done your hours. So you have to have done your hours to be able to register as a nurse. So we take attendance registers for all your theory and obviously monitor your attendance in practice. Because if you don't attend your practice placements enough, they won't be able to assess you. So it means you have to attend continuously so that they can work with you. Likewise with your theory sessions, we have to show that we monitor everyone's attendance and it's recorded, because we have to be able to upload your hours at the end of it. So it's unfortunately, if your students show that they've missed high levels of either practice or theory, we will interrupt your programme. Thank
you. Do you have any tips on how they can calm their nerves before interview?
I think just be prepared. Don't be alarmed. It's just a conversation. Make sure the way to get rid of nerves for anything is just to be really well prepared. And we're not trying to catch you out. We're not trying to trick you. We just want to talk to you. So think about coming along to talk to us rather than being interviewed.
Somebody's applying for Nursing Foundation. I just wrote my IGCSEs and I was wondering what kind of reference you'd be looking for because I have no work experience.
We don't have a Nursing Foundation, so I'm not quite sure what that's about.
My passport has expired and my new one won't arrive in time for my interview. Can I still use their expired one?
As proof of your ID, but when it comes to doing things like DBS or further checks, we will need your new one, but obviously if you applied for that one, that's fine.
Thank you. I've no previous healthcare experience. What would retail customer service be relevant as transferable skills?
I think I covered this in the session.
Yeah.
Anyone that's worked in retail, worked with the public, fantastic skills, time management, team management, working with the public, customer service skills, all really, really important. And it doesn't matter if you haven't had healthcare experience.
Okay, is it true adult nursing is one of the most challenging courses in the university?
Absolutely. All the nursing and midwifery courses are challenging because you've got clinical placements alongside academic work. So, you know, you have to be committed to both of those. But what I would say is that nursing and midwifery courses guarantee you employment at the end of it. So we also know that nursing and midwifery graduates start on higher salaries than other graduates. So it's worth it in the end.
Okay, thank you. There's some more people raising their hands. Unfortunately, I can't unmute you to talk. If you've got any questions, put them in the Q&A, please.
Somebody else, placements in hospitals,
yeah.
All the hospitals are linked with specific universities. So you haven't said where you work, but we can only use the hospitals that are linked to us. We can't use others. So if you are working in a particular hospital, you need to find out which university has its students there and apply there.
Yeah, thank you. If I start off with adult nursing, can I switch to child or mental health nursing during the course?
It's too much of a gamble because the only way you can switch is if there's places, and if there aren't any places, you can't. So you need to make your mind up before you start on the programme about what you really want to study.
I think we've already answered that about interview spaces.
The space is coming out this week. Keep your eyes peeled.
I am only in my first year of college. Is this something that I should be considering?
What?
Obviously, if it's something you're considering, like you've come to this live talk today, I think it's great that you're doing your research early, and it will start to prepare you for next year if that's what you're looking at, wanting to study nursing in the future, or midwifery maybe. Anything to add there, Caroline?
No, that's fine.
I want to do we don't offer that course here at this university. I would recommend that you do some research on UCAS, look at the course who does offer that, and contact that university. What's the difference between the Masters in Nursing and the BSc?
We don't offer a Masters in Nursing, so what I would suggest is have a look at the universities that are offering a Masters and see what they're looking for in terms of their entry requirements.
Is there a particular age for midwifery?
No.
No. Do we have a maths assessment in the interview?
No.
Would there be anything on somebody's declaration form that could affect their chances of getting a place?
Absolutely. If someone's got a long list of convictions, if they have any custodial convictions, that normally excludes them. But I wouldn't be able to say any more than that at this stage without knowing.
Are you awarded degree class first, second, 2-1, etc. at the end of midwifery, and how does this affect your job application?
Yes, we do. You will get a degree classification. And it depends which job you're going for. What you need to bear in mind is that when you're working in our partnership trusts, they're looking to employ you. So, you'll be working in certain areas, and quite often the people in charge of that area say, make sure you come and apply for us at the end of your training. So it's not just about your academic qualification, it's about, how they perceive you through your training as well.
Yeah, thank you. What would you recommend for the interview, how to prep, etc.?
Perhaps go back and revisit this session because it's all in there.
Thank you. Does student finance fund top up master's courses? Not usually. I would say we've got student finance on Unibody. You can pop over to them, they'll be able to answer that. But there is separate funding for postgraduate study anyway that you could apply for. So if you look on the student finance pages, you will see what's available for master students. What if we got predicted grades this year and we don't meet the requirements? What if if we got predicted grades this year and they don't meet the requirements?
It's hard to tell at the moment because a lot of it depends on how many people don't get predicted grades, because if everyone gets their grades, then we will be accepting them. So until we get to that stage, I really can't predict at the moment.
Mm-hmm. I've met the criteria but still haven't received an interview date.
You don't say whether you've been shortlisted or not.
Yeah, and it depends on when they've applied as well.
Yeah, but please be patient. We've over 1,000 of you already booked in for interviews, and we've got about another 500 who are waiting. So we're working on it. So don't worry, you will hear from us. We will be offering interview dates to everybody who meets the criteria.
If they've been interviewed, how long does it take to hear back from us?
Well, for the interviews that we carried out on Saturday, those decisions are being processed at the moment. So you should hear within 5 days, 5 to 7 working days, we hope.
Thank you. If you want to apply for 2022, when would you apply to UCAS?
When UCAS opens for that cycle, which will be around October time.
Mm-hmm. Thank you. Hey, I have tried to book an interview, but okay, we've already spoken about that. Caroline's released lots of interview dates today. They will be available shortly, so watch this space.
Keep your eyes peeled for those.
I've applied for midwifery starting this year, but after leaving secondary school, I went straight into work and don't have A levels. Would this affect my application?
If you haven't got level 3 qualifications, then you won't be shortlisted. You need to have either A levels or equivalency, so Access or BTEC. And this is all on the website, so you can go and have a look on the midwifery page on our website, which details the entry qualifications. But if you haven't got any level 3 qualifications, then you won't be shortlisted.
Yeah, and what I would say to you is go to your local further education college, look them up, and they should have access to a level 3 course that would then get you into university next year or the year after, depending on what course it is.
Or even the online access courses, the distant learning courses are very good as well. We take students who've done those. So look at what's needed and start preparing for next year.
My name is, I applied to do for the BSc qualification adult nurse for September. And I was submitting my application to you, associate nurse. So they've done a foundation degree as an associate nurse, hoping to start from year 2, but my application for interview was rejected yesterday without being given a reason.
I can tell you what that reason probably is that if you've applied for year 2, our year 2 is full. And that's because we have to manage the students that are already on the programme. So the students that are already our students, and also we always have students that are waiting to return because they've been interrupted. So it's likely that we just don't have room in year 2. So we can't offer you a place and then not be able to fulfill your placement. So that's why.
Thank you. What if I've got rejected in Middlesex for failing one subject requirement? I don't know what that means.
Do you mean you didn't meet our entry requirements? We have to be really fair with our entry requirements. So we can only accept people who meet our entry requirements because, you know, we have a gateway for a reason.
But we've already spoken about lectures and how they are currently working. Do students ever receive job offers from hospital placements after their training?
Absolutely they do. So, you know, you've got a 3-year interview.
What are the things that interviews do not want to hear?
We don't want to hear that you've been inspired by Holby City or Casualty or that...
Call the Midwife?
Call the Midwife, yeah, please. Don't talk, you know, if you think it's going to be like a television programme, then you'll be very sadly disappointed. I also don't want to hear things like you think academic work is boring, or that you want to be a nurse because you want to be a children's nurse, particularly because you like children. That doesn't mean anything, you know. It's about being a professional, having a professional approach to your interview.
Okay, thank you. Next question is, if I get a children's nursing degree, am I able to go into psychiatric nursing in children?
I think what you probably find is that there's lots of crossover now between the fields. So what you possibly do is get your registration as a children and young persons nurse, and then perhaps do some post-registration study, particularly in the areas of mental health in children. So yes, it is possible.
Mm-hmm. What ratio is student and tutor on placement?
We don't have any tutors on placement, so I don't know what you mean by that, because the tutors are in the university.
Okay, I'm just going to ask this. Is it possible to apply direct? No, everybody has to apply through UCAS before the 29th of January. My ultimate aim is to be a health visitor. Would you say that it would be a sensible approach to look at spending a few years in hospitals gaining experience first?
I would say any experience is always useful, but have a look at specific requirements for health visiting, see what they want from you. Perhaps if you get a chance to talk to some health visitors as well and see what they recommend. Because I don't think you can go into health visiting straight after qualification, but it's worth finding out what sort of placements they would what sort of jobs they would look on as particularly useful for that area.
Okay. Will I be able to cancel my interview due to family problems and rebook again?
You can do that. You can actually go in and rebook it yourself.
Thank you. When could I get my interview, please? As we've just spoken about, interview dates have been released. If you've applied to us, then watch this space. How far along the course do you go on placement?
Well, at the moment, the first 2 student nurses have started this week. So they started on the programme in September and they've gone out into placement this week for the first time.
How do I apply for interview? If you've applied to us and you've been shortlisted, then you will be sent relevant information. Is that correct?
Yep. So you need to apply through UCAS, and then once we've shortlisted you, we will send you the emails inviting you to book an interview with us.
Do you offer unconditional offers?
No, we don't.
Do you have any tips on how to calm a nurse for interview? As Caroline already said, treat it, just prepare well, really.
Yeah, just prepare and think about what you want to talk to us about. Don't think about us asking you questions. Just make sure you're well prepared.
It's the standard fees is for nursing. If you're a home student, it's £9,250 per year. And then on top of that, you get a maintenance loan you can apply for, and also the bursary, which is £5,000 per year for nursing now. Do you look at numeracy units within an access course if I don't have maths, GCSE or functional skills, or
Yes,
is maths an essential?
We will look at your maths unit within your access course. We will use that as proof of your level 2 numeracy.
Who are the people that can support us throughout the nursing course?
Well, there's also, depends what support you need, because there's academic support all the way down the line from the university. There's help with mental health and counselling if you need it from the university. There's support from your colleagues. There's support when you're in clinical placement from your supervisors and also from the academic staff of the university. So Middlesex is known particularly for being a supportive university. So we're very aware of the need to support our students.
Is there a selection process apart from the interview?
Well, the shortlisting and then the interview, and then we would look at things like your academic qualifications and your reference.
Mm-hmm. And then obviously you need to meet DBS and occupational health as well. Is that a final stage?
Yeah, but we will sort that out with you.
Yeah. Are you accepting more applicants this year because of the current situation?
No. The problem is that we are entirely dependent on our placement capacity. So as a university, we could fill the university with applicants. But what we need to make sure is that you have a positive and supportive experience in clinical practice, and overloading all the placement areas with lots of students is dangerous. So we can only provide students for our placement areas that we've audited and they've agreed to take and that will be supported. Otherwise, you're not going to learn anything and it's going to be really stressful and not a positive experience. So our numbers are the same as last year. And in case you're interested, that means we're taking in 450 nurses and midwives. So it's not just as simple as offering lots of places unless we can offer you the proper experience for your 3 years.
I've received some grades I was waiting for since applying. How do I update my application? If you go over to the admissions chat on Unibody right now, our admissions team will be there and will be able to do that. I think you'll be able to upload them onto the portal.
If we hold your application, yes.
Yeah. But if you go over to our Unibody chat, they'll be able to advise. If accepted into the university, would we have to provide a DBS certificate?
Yes, every student has to have DBS clearance. So if you already have a DBS, you can subscribe to the update service. If not, once you've received an offer from us, we will take you through the process ourselves.
Mm-hmm. Thank you. Well, all of our entry requirements are available on our website for all of our courses. Yeah. What question do I need for Middlesex University? Again, everything is on our website as to what the entry criteria is for all of our courses. We've spoken about parking. No. I've sent my application last week. Are interviews still available?
Yes, they are. We were dealing with all the applications received before the 29th of January.
Are piercings on your face okay for the interview? Of course, they could be removed.
That, but you need to be, obviously for placements. No, we don't mind piercings for interviews. That's fine.
Thank you. How do I listen to after this workshop today? Everybody will get the recording within the next day or so. How long do you take to contact students after the interview? About up to a week, did you say? 7
days. It depends when you were interviewed.
When you want to join this webinar, is it possible for the recording of this? Yeah. Yes, you will get it as long as you registered to attend today. Will we be vaccinated during placements?
It depends what you want the vaccination for. There's all sorts of different vaccinations, so I don't know. We will all need occupational health clearance before you start on the programme. And I'm assuming that by September, everyone will have been offered or will have had their COVID vaccination. There may be issues if you don't want to be vaccinated. It may be that the trusts will say they won't have you in their clinical areas if you're not prepared to have your COVID vaccine. So if you're not keen on it, then you need to think very seriously about that.
How long are lectures?
Depends.
Yeah.
It could be a 20-minute lecture with associated work. It could be 2 hours. It varies depending on what you're being taught and at what stage of the programme you are.
Okay, we've answered that question about vaccinations. How will be assessed or carry out the exams? How will they be assessed?
Be assessed through submitting your work. There's only one exam at the moment in year 2.
Yeah.
It's submitted electronically, so yeah, not an issue.
Yeah, we've spoken about placements. You do them in the first year. Do I need the COVID? Again, we've spoken about that.
I strongly suggest that none of our clinical trusts will take students who are not vaccinated.
Yeah. I booked my midwifery interview for tomorrow, and they replied saying I would get a confirmation email, but I haven't received it yet. I would check your spam emails because it may go into your spam emails. What would you do? If you go over to the admissions team chat on Unibuddy, they should be able to help you now. What is the issue behind the school not accepting results that the year is more, if they are more than 5 years old?
Yeah, we don't accept qualifications that are more than 5 years. This is a professional program. We need to make sure that your knowledge is recent and up to date, and the 5 years is the cut-off date that we've agreed.
What would you need to bring to interview? Again, that will all be on the email that you've received from us. Is that right, Caroline?
You just need photo ID. That's all.
Where is the location? We're based in Hendon, up in London. If you look at the Northern Line map, you'll see Hendon Central on there, and we are about 10-minute walk from that tube station. Will there be any scenarios asked in the interview?
No, sometimes we might use a scenario to accentuate something we're asking, but we don't set scenarios because not everyone's got clinical experience, so it's not a useful tool to use.
Okay. Their interviews tomorrow. Say good luck for tomorrow. Just prepare well for it. When will I know if the interview was successful? Again, it's a week later. And in nursing, is there exams, and what year do you do them?
We have one exam, and that's in year 2.
Okay. I do not meet the 112 UCAS points. Shall I wait until clearing?
No, it's highly unlikely we'll be in clearing this year. We're looking to close programs on Friday, so.
And I worked in clearing last year, and we wasn't in clearing last year for some of the programs. So what I'd be saying to you is, if you haven't got the UCAS points, I would be contacting your local college to try and get a qualification that will get you in next year. How many hours do we have to practice per year?
When you're out in clinical placement, which is about 12 weeks of a year, you're doing 37.5 hours. So that's 5 7.5-hour shifts or 3 long days.
I chose mental health, but keep thinking as well, learning disabilities. Love both of them. Do you think at some point the uni will ask to change?
No, we're not changing to learning disabilities.
No. Do you learn social work psychology while studying mental health nursing?
Yeah, that's included within the programme. But if you want to know more about our modules, they're all on our website. So if you go and look at the mental health nursing page, the modules are there, which will help you have a better idea of what we will be teaching you.
Okay, we've spoken about exams.
There's only one exam in year 2.
What about coursework?
Coursework is it's essays, it's online tests. Obviously you're assessed in clinical practice, which is 50% of your programme. So lots of different assessments we use. Yeah.
And are NARIC equivalent grades accepted as entry criteria?
Yes, we take NARIC equivalency.
As for placements, how many hours? We've already spoken about that.
37.5 hours a week.
Yeah. How can you help? If you need extra support from us, we have our wellbeing team and our uni help team will be able to help you. So when you complete your UCAS form, ensure that you indicate what support you require, and somebody from that area will contact you if you were to be offered a place at the university. Would someone from the faculty also contact them, Caroline?
No, we will suggest they make contact with the people that can help them.
Yeah.
But we have lots of students who have dyslexia, so don't worry about that. You won't be unusual in that way.
What do you mean by academic work?
Academic work means the work that you have to complete to meet the academic requirements of the programme. So that's writing essays, it's doing research, it's reading, it's doing online work, it's all the stuff that you need to give you the knowledge to be a safe nurse or midwife.
Please, is it possible to change from adult nursing to midwifery during interview?
Absolutely not. No, if you've decided you don't want to be an adult nurse and you want to be a midwife, you'll have to submit a new application, because midwifery is massively oversubscribed, and the people that have been invited for interview have all written their personal statements to demonstrate their commitment to midwifery. So no, don't be, if you do that halfway through your interview, you won't get offered anything.
Do we have a call while in placement? Do we have
On call? I think midwifery.
on call? Oh, okay.
You said what what area you're looking at.
I was just wondering what nursing courses offer foundation.
None of ours.
No. I have an interview booked. Do I need to do anything else online other than prepare for my interview? Do I need to show passport, driving license, and can I have notes with me?
Yes, you need to have something to show your identification. I try not to be dependent on notes. It's not that kind of, it's not a test. More about, you just talking to us. I don't think you'll need notes, but if you feel like you need them. But I think sometimes reading notes can
distract you. Yeah. Are placements for mental health nursing in hospitals or community?
Yes.
They're in both places, aren't they? Yeah. That would apply for all branches, wouldn't it?
Yeah. Well, we use community and for child, adult, midwifery, adult. Yeah.
Yeah. So if this question has already been asked, I've only just been able to join the webinar. I can see it has been recorded. Yes, if you've joined the webinar and we have your details, then you will get a copy of the recording. How many places do you accept after interview? We've already spoken about that. It's
not happy to. This is not for all people.
Not good.
Well, I'm really sorry, but we're trying to do what we can.
How many days a week are lectures?
Usually 2 to 3 days a week, but at the moment the students aren't coming into the university, so they're it doesn't, your lectures can be attended at home.
Caroline, I think there's so many questions here that I think we've already answered, and actually Unibuddy is only open till 6:30 now. And we do have our students on our course pages that are able to answer all of the other questions if we've not answered them today. But do you think, thank you for joining us. If you've joined us today, we will have all the recordings available to you. But I think we need to wrap up this workshop now.
Yeah.
Is that okay? What do you think, Caroline?
I mean, I'm happy to carry on.
Okay, we can carry on for a little while, but if they want Unibuddy, it is only open till 6:30. That was the reason for it.
Yeah.
Yeah. So what is the difference between BSc and B Nurse?
There's no difference. They're the same qualification.
Okay. Do all children's nurses all children's nursing courses end with a guaranteed employment?
Yeah, I'd say so if you want it.
Mm-hmm.
Yes, you only need to bring your passport to the interview.
Yeah.
Which I don't know what this question is. I don't know if that's you who asked about
the question I had typed earlier, please. I don't know what that question was.
I think you were the gentleman that asked about year 2 entry, and I did answer that question. And we don't have any room in year 2. That's the answer.
Thank you.
How many modules do we have to read? Your modules are all on the website. I'd suggest you take a look at the website. What happens if you're unable to answer the interview questions? Then you're probably not going to get an offer, sadly.
For children's, would the placements only be in hospitals, or will they also be in other settings such as clinics?
Yes, they will. Clinics, communities, wherever we can get you a placement. We are sending out, we're dealing with all the interviews and shortlisting at the moment, so please be patient. We will get back to you.
How would I be able to access the seminar afterwards? You'll get an email with the recording.
Our lecturers are able to help students, but that's our job, is to help people who are struggling. So yes, we will do that.
What if you have maths but no English?
Then you need to go and get level 2 English qualification, and that'll be the same for all universities, not just us.
How many spaces do we have for midwifery?
About 100.
Thank you. How many places are there if you have it? If you have an interview, what are the chances of getting a place?
Depends how well prepared you are. That's entirely up to you, not us. People ask about how many places. There's 450 places on the nursing midwifery programs, but that's why you need to be as well prepared as possible.
When will the deadline for the interviews be? I'm assuming, I'm thinking, Caroline, that when you apply through UCAS, we have to get all of our decisions back by a certain date. So if you're an early applicant, then we aim to get them all back by the end of March if possible.
And we're interviewing at the moment, so we've started interviews and nearly all the shortlisting's done. So it's just a question of making sure that we've got enough interview dates.
Mm-hmm. And we've spoken about that already. And replace it. How many? Yeah, we've spoken about that. We've answered that question. If you get 112 UCAS points needed but don't get the exact B for each subject, will you be accepted?
If you get 112 UCAS points, we will accept you.
Yeah.
I don't know what to do about yet. What if the person from the Romanian embassy, you need to go over to admissions and ask them that.
Yeah, we've got the international office over in the Unibody chat as well, so they'll be able to help you. I've just got, okay.
Cash level 3 qualifications. We don't take cash level 3 childcare qualifications, because that's about looking after children, but we take health and social care. How many cohorts does the university have and how many students in each? We have one intake a year and that's 450 students.
Thank you.
No, they don't ask the same questions at all universities. Clearing, no, we won't be in clearing this year. And if your application is rejected the first time, then we won't be considering you again in the same cycle.
After this interview and the person accepted, what will be the next step? If you get offered a place, then you will be you will need to meet all the conditions and you will get further information from us.
Yeah, we will tell you what to do. Don't worry, we will keep you informed about what you need to do next.
Do you accept foundation year qualifications from other subjects at Middlesex, i.e. veterinary nursing, if you do not have the level entry requirements?
If you've got a foundation year from another university and it's relevant, so if you're applying for vet nursing here and you've done foundation year somewhere else, then yes, we would. We take foundation years from other universities.
Thank you.
Zainab, you need to listen to this webinar when we send it out again.
Yeah, I mean to the next day. Okay. How many days in placement? We've spoken about that. I do a cash level 3 extended diploma. Will the entry be the same or similar to the BTEC?
Yeah, it's 112 UCAS points.
Mm-hmm. Thank you. I'm really nervous to interview it. Yeah. As we just said, you need to just prepare well to calm your nerves.
Yeah.
Do you accept? We've already answered that question. Is my first year of college, when should I apply? You need to apply, if you're applying for 2022, then you need to apply in the new UCAS cycle that usually opens towards the end of September. And if you're at college, your college will support you with that. What do I need to study in nursing to work in both children or adult nursing?
You need to decide where you want to study. You need to decide whether you want to be a children's nurse or an adult nurse and take it from there, because you can't do both.
No. I got through to the interview stage, however, I'm still waiting for my maths GCSE. Will this affect getting a place?
If you're studying your maths and the result is pending, it will be part of your offer. So your offer will be conditional upon meeting your entry requirements.
Yeah. Can I get rejected for not doing well in my first year, even though I'm on track getting the required UCAS points by the second year?
I'm assuming you're talking about being at college. If your predicted grades when you apply are that you will meet our entry requirements, then we wouldn't reject you. So it's up to how your college presents you rather than our decision.
Yeah. Could I get rejected for not? Oh, well, I've already done that one. Okay, sorry. Is it possible to get rejected based off your personal statement?
Yes, it is. Your personal statement is not appropriate or doesn't show that you've considered the challenges of the programme, or doesn't really show that you've met our, what's the word I'm looking for? So, for example, some personal statements I read for perhaps midwifery or children's nursing don't mention specifically that they've considered what it will mean to be a student nurse or student midwife, then you could very easily get rejected on your personal statement. So that's why it's really important that you access all the help that's available when writing it. You know, make sure your personal statement is really about what it is you want to study.
Yeah, and there's this question here: how will practical work be carried out now, online lessons?
Practical work. I mean,
do we still have students, not right now because we're in lockdown, but outside of that, they were still coming in for the practical element? They're still coming to skills labs?
Because we have to prepare you for placement. So we've had students coming in to do their skills sessions, moving and handling, CPR. So we have to make sure that you're safe to go out into placement.
Yeah. Thank you. I've just finished H&D in social and community work. Do I start from year 1 or year 2?
No, because you don't have assessed placements that are NMC compatible in that programme. So you'd have to start from year 1.
How does the placement work? Do we work along with nurses or watch and repeat?
No, you'll be supported by other nurses, but you'll be taught and shown how to carry out things, how to work with patients. So you're supported during your placement time.
We've spoken about what sort of questions that you may be asked. You will get all of that information sent back to you. How placements being handled during this COVID period?
All our students are out in placement. We are ensuring their safety at all times, and that we're working very closely with our colleagues in our trusts to make sure that our students are supported and looked after.
During the placement, am I just with other students or other staff on the ward who will support us?
Both.
We've spoken about how many places we've got. Where can I find? We will send that information to you. If I say I was inspired to be a midwife due to my experience I had while I was pregnant with my baby, and even after I gave birth, the way the midwives treated me with great care, will that be a good answer? I'm just going to go on while I wait for Caroline to answer that question. Does the £5,000 bursary go towards tuition fees? No, it's given to you over the period of the year, and I think it's split into 3 chunks, like the student finance, and you won't have to repay it, but you do have to apply for it separately. How does the 50-50 placement? Okay, Caroline's back. Caroline, they were just talking about, I was inspired to be a midwife due to my experience I had while I was pregnant with my baby, even after I gave birth. The way the midwife treated me with great care, will that be a good answer?
It's a good start. But then, you know, what did you do after that? Did you then explore the role of the midwife more? Where did that take you? You know, I'd like to see that was the trigger, but that you did further work from that.
Thank you. How does the 50-50 placement and theory work apply?
It's in blocks. So if you bear in mind that the first years have just gone out into placement, so we spent the first from September getting them ready for that. And then you have a block of placement, and then you come back in for a block of theory. So you don't do 1 day in university and 1 day out in placement. You're out there for 4 weeks, 6 weeks to really become part of the team and get used to working alongside your clinical colleagues.
Thank you. Your bursary, you will apply for that when they open in the summer. But if you look on the Student Finance website, there is all the information about student finance and the nursing bursaries now. I get my maths result in August. Will this affect your decision?
Yes, it will, because we need to get our numbers firmed up by the latest July, because we have to make sure we have enough students. If we don't have enough students, then we're going to have to go into clearing. So we need to make our decisions early. So anyone who's got GCSE results and they're not going to get them till August, then we won't be progressing our application.
What does it mean if I've sent my application last week and I've not received an email yet?
It means we haven't shortlisted you yet, or haven't had a chance to look at it. So if you think about it, we're dealing with thousands of applications at the moment. So please just be patient. We will get to you. Okay.
Somebody asking if they've if I have a settlement status and live in the UK more than 3 years, EU citizen, would I qualify for home status fees? I would suggest you look at the student finance website pages to see who's eligible and who's not eligible for student finance now. But also, if you go over to our live chat on Unibuddy now, it's going to shut in a minute, they should be able to answer that question. But they are on live chat every day, the admissions team, so somebody will be able to answer that for you. Could you please repeat the selection process before the interview again?
What that means.
Selection
process before the interview is just that we shortlist you according to a UCAS form.
Yeah, you just need to make sure you've completed your UCAS form, all of the sections, including what you're currently studying, what you've already studied. You've put your referee information on there. You've done the most up-to-date personal statement and all your relevant work experience. And hopefully then you meet the criteria and then you should get shortlisted.
Mm.
Yeah. How does the university support students with dyslexia?
We're very well, but again, there's lots of information on the website about the support we offer. So don't worry about having dyslexia. Lots of our students have dyslexia.
Yeah, and we've already spoken about how long it would, the interview, after the interview process, it takes about, if you've been interviewed, it'll take up to a week. Is makeup allowed on placements?
Within reason, yes. Don't have things like false eyelashes, because if they fall into wounds or commodes, you'll know about it. So, you know, things like hair extensions can be problematic. But yeah, people, you're allowed to wear makeup, but just be careful about, you know, what it is.
Or plain makeup, really, isn't it?
Yeah.
I've done my foundation year last year and waiting for my results now. I'm doing my first year in health and social care while waiting for the results. Do I need to carry on with the course, or shall I stop and wait for September start?
Well, if you've got your entry requirements, which your foundation year is, you can apply with that. I'm assuming that you're doing first year BSc in health and social care. So, you know, your foundation year is your entry requirement. So that's entirely up to you, really.
Mm-hmm. Thank you. I don't have questions in the UK. I have the from Portugal, and it is a different field. It's social work. Will this affect my application?
Depends if you studied in English, and it depends how old they are. If they're older than 5 years, then we wouldn't accept them. You would need to have studied in English or have an IELTS of 7.
Would you expect someone to show their face during an interview? Definitely, because if you wasn't doing it via Zoom, that you would be meeting them face to face in the university.
Who knows who you've got to come and do your interview instead of you? No, we need to, because you have to show your photo ID and you. So yes, we'd like to see your face. Thank you.
I want to apply for mental health nursing year 21. Can I apply direct to the university? No, you have to apply through UCAS.
Yeah.
Before the 29th of January.
Mm-hmm.
Clinical placements start at 7 a.m. So what time do they end? They're usually 12 hours, aren't they?
Well, it depends. If you're doing 12-hour shift, that'll finish at 7. If you're doing a short shift, it'll finish at about 3.
Yeah. Access course students, what is the overall grade that is expected? Well, you're expected to pass your access course with your 45 credits, merits, and then all of your level 2 parts of your access as well to actually complete and pass an access course.
The 2 questions asking about exams in midwifery. Yes, you have at least 1 exam in midwifery, but then you need to think what you mean by an exam, because we have things like clinical examinations where you're examining women and babies. So yes. Somebody asked me about you not be able to be in class. You have back pain. I would suggest if you can't be in class because of back pain, you're not going to be able to attend clinical placement where you're on your feet for long periods of time. So that, you know, nursing might not be the career for you if you've already got a bad back, because it's not going to help it.
I am 55 and was wondering what my chances are of getting a job once I qualify in mental health.
No problems at all. We've got lots of students who are your age and older.
Right, we've done that one.
Mm-hmm.
If the interview is successful, does that mean I've been accepted on the course?
Yes, it does. It would probably be a conditional offer, dependent on your qualifications and your DBS and your occupational health. But your email that comes from the university will confirm that.
Yeah. Will the university contact us when the date of interviews is available? You should keep an eye out on your emails, check your spam emails in case it goes in there. And then, as Caroline said, there's interview dates been released. You should be able to book on to an interview as long as you've been shortlisted. I've had my interview on the 5th of January and I still haven't heard back from you. It will be 3 weeks tomorrow.
There was a delay at the beginning of the processes when we were first starting because some of the paperwork wasn't quite ready. So I know, as far as I know, that all the decisions have now gone off to be dealt with. So you should be hearing back very soon, but if not, get in touch with admissions.
Yeah, if you go onto the live chat any day, somebody will be able to answer that question and help you. Are interviews online now, or do we have to? No, all interviews at the moment are online.
Yeah.
Via Zoom. If you do an MRI, is it time? You will need to speak to the university that offers that. Do all students have to take the COVID vaccine?
I would suggest that our clinical partners, nothing to do with the university, but our trust will be very unlikely to accept you onto clinical placement without vaccination.
I went on iOS due to diagnose. Okay, have 60 credits in year 1. Do you allow expeditions? And I have reference from 2017 access.
I don't understand what that means.
No, I would suggest you contact our admissions team with a copy of your qualifications, or again, visit us on our open day on the 27th of February and they'll be able to answer that question for you. Please, would the recording be sent? Yes, it will be resent in the next day or so. Yep, that's the same one. Somebody has a speech impairment. Will this affect my interview?
Absolutely not. No, please just relax. Don't worry about that.
Take with me to interview. Okay, well, it's going to be online and you'll get an email with what you need to take to interview.
Yeah, don't worry about that. We'll tell you what to do. If midwifery is in demand, why is there small numbers that can attend? Because we don't have the clinical placements for it. We're entirely led by our trusts and the students that they can take, because they want to make sure that you're safe and supervised in clinical practice. It's nothing to do with the university. It's about the placements that are offered to us. So if you think as a student nurse or midwife, you need to be supervised, not just left to get on with things, we have to make sure that those systems are in place to look after you.
Thank you. Are you in contact with any of our graduates? I'm sure you are if you go out.
I'm one of the graduates, yeah. Our graduates are out in clinical practice with qualified nurses and midwives, supporting our students. Some of our graduates are now working as academic staff at the university, teaching skills. So yes, we have a very close relationship with current students and graduates.
How many places have we offered at the moment? Obviously, I would say that that's not a question we can really answer. Caroline's offering as she sees fit at the moment, and everybody that's applied before the 29th of January will get a fair, their application will be looked at equally.
Yeah. Somebody said you take level 3 childcare, now you said you don't. We don't take level 3 childcare for midwifery. With vocational courses, they offer a particular study, so they prepare you for the next level of study. Childcare is not midwifery. Adult care is midwifery. So you're not looking after children. So childcare would be suitable for children's nursing, and we would consider it for that. No, we don't give out unconditional offers for any of our programs.
Does everyone get the bursary? Again, you would need to apply for it, and you will need to meet the requirements for a bursary. Do you get placement dates in advance? Yeah,
so once you know where your placement is going to be, it's up to you to contact that clinical area and request your off-duty or rota, and obviously if there's anything that, you know, any request that you would like to make, then they will ask you about that as well. So you normally get that. It's up to you to contact the area yourself once you know where you're going.
We've already, with the bursary, is available for nurses and midwives.
Yeah, students will, I think, will have to have the COVID vaccine to be allowed to go into placement.
Have we an interview, or do you have any suggestions?
Yeah.
Prepare.
Get an early night.
Prepare.
Yeah.
What about international students? What you need to do first to apply for midwifery?
If you're a tier 4 student, then we don't take you onto professional programs because of your work restrictions once you've qualified.
Will you be at the same hospital throughout your placements for midwifery, except for course whilst in community placements?
We will certainly try to. That's up to the trust. What we need to make sure is that you get your placement hours in. So whilst we allocate you to a particular trust and they will work with you, there may be times that, such as community or clinics, where you'd have to go somewhere else. But normally we try and keep you at the same trust for whole of your programme.
To the person that's studying an access course, they will get UCAS points now. They do actually get UCAS points. If you look on the UCAS tariff calculator, you can put all that information in. It will tell you exactly how many points your access course is worth. How much money do you get for midwifery grants? The bursary is £5,000 a year, and the maintenance loan will go on each individual person when they apply. If you've seen on applications that GCSE maths results will be in August, why take it further to interview?
Chloe, can I just say, I've looked at your application form just now when I saw that. And as I said earlier on in the presentation, if you're studying maths as part of your access course, we will accept that. So that's why we've processed your application further.
Thank you.
Other universities have different approaches. So we're trying to be as flexible as possible, as we know it's a very difficult time at the moment. So that's why we've made some changes to our approach to our students for this year. So that's why you've been invited to interview.
Do you accept late applications? No.
I wouldn't gamble on a late application this year, because if we've had so many applications, then other universities will be the same. So don't leave it too late.
What are the main questions asked during an interview? We've obviously spoken about that in the recording. You can get that information. If I get accepted and something happens in my personal life, can I defer 1 year or have to reapply?
No, if anything happens like that, it's important that you talk to your tutors and the academic staff. And there's lots of people in the university to help with that. It may be that you might need to take a short deferral for a while, or they'll suggest you return in a year's time. But we will support you with that. So don't worry. There's lots of help for things like that. We know things happen in people's lives. It's one of those things. What we would suggest is please don't get pregnant.
Do you get a bursary for the midwife course? Yes, that everybody does, as long as you meet the criteria now.
Mm-hmm.
Who will be the interviewers?
Well, it depends what you're applying for, because it's we use as many people as possible to help with the interviews, so that it's shared out amongst all the academic staff. So it will be a member of one of my academic colleagues, possibly a service user, but they're experienced at what they do. So don't worry about that.
How long does the interview last? It's about 20 minutes, 15 to 20 minutes is interviews. How long are the placements? Caroline just spoke 4 week blocks or 6 week blocks, maybe.
Yeah, 4 to 6 weeks, and then you probably have a final placement of about 12 weeks normally at the end of the programme.
I was accepted based on my qualifications, but I just heard you say you don't accept level 3 childcare.
Depends what you've applied for.
Yeah.
So again, either drop me an email or talk to admissions tomorrow about this.
Yeah. Thank you. Am I able to find a job while studying adult nursing? Lots
of our students work in things like nurse bank, or they work in care homes. So yes, lots of people do work, but not when you're in placement, because you're working full time then. But normally when you're doing your theory weeks, quite a lot of people do some part-time work to fit around their studies. Yeah.
Thank you. This is the same question we've got. This person that's asking the question about the went on to IOS due to cancer. Guys, I would suggest you contact our admissions office or drop Caroline an email through the Unibuddy chat, which she has, which if you go to the adult nursing page, you should be able to see that information. And with further information, and then we'll be able to answer that question.
If you're saying that you've 60 credits for year one, I don't know, is that with us or with somebody else? It's quite a complicated question which you're asking us there. So I would suggest either drop me an email through Unibuddy or go to admissions and ask for their help. But I don't want to get into a conversation like that through this.
Yeah.
Again, please contact me through Unibuddy or admissions, and I'll be able to answer that. But you can't just keep asking me the same question without giving me any more information.
I currently applied for child nursing. What happens if you do not have any experience with childcare?
Well, then it's up to you to explain to us why you've decided you want to be a children's nurse, and that's about your preparation for interview. It doesn't matter you haven't got any experience. It's about your decision to study for that program and why you've made that decision.
Yeah. Thank you for asking. I was just worried about my chance to get placed, so I just gently come to that. How long is the interview? We've answered 15 to 20 minutes. How long will it be? Will an accepted application take to put on UCAS track?
Well, that's a UCAS question, is it? Because we don't put you on UCAS track.
No. Yeah. As soon as you apply through UCAS, as long as there's nothing wrong with your application, they've taken the money and they've got your reference, then we should get your application quite quickly because it's all digital now.
Sasha, I'm a little confused about your answer with regards to GCSE math. Sasha, if you look on our website, it actually says that we won't accept your application unless you have your maths and English level 2 at the point of application. So it's quite a simple answer really, because it's about the management of the programme and management of experience for our students. That's why we don't accept them, because if you think about it, our course starts around the 12th of September and the GCSE results come out on the 24th of August. If we have to wait until then to confirm our places, it's too late. Because if you don't pass your GCSEs, it's too late for us then to go into clearing. So the decision is made that for most people that they have their GCSE maths and English at the point of application. However, we then say we'll take foundation functional skills because the results of those come out much earlier. So we're trying to be as flexible as possible, but it's about our programme management as well. So if you think about in terms of 450 students, if 20 of those are GCSEs and they don't get them, that's a big gap in our student community that we won't be able to make up. So it's not an easy answer, but I'm hoping that makes some sense to you. But if you'd like to discuss it with me further, then again, use the Unibuddy and contact me through that.
Thank you. What if Zoom doesn't work properly during the interview? Well,
we'll either try and work around it or we can rebook you. Don't worry. Don't be stressed by it. It happens. People have problems.
The same person's asking the question. They've got an interview tomorrow for midwifery with their childcare, with their level 3 childcare. I would suggest that they attend that interview and have a discussion with the interviewer.
Yeah. No, don't discuss it with the interviewer because it'll confuse them. No. If you just drop me a line tonight, you can put it into Unibuddy. I can look at it before tomorrow. But please go for your interview. Please don't worry about it. We've got you this far. There's a reason for it. So please stop stressing. Focus on your interview. And as I've said, please just drop me a line through Unibuddy.
Thank you. Do you get paid during on placement?
No, you don't.
No.
The university program.
The interview, it's a panel interview. There'll be 2 people at interview.
Yep.
So that's
Sasha, if you're doing level 2 maths in your access, we will accept that. However, as I've said, other universities have different rules. If you're applying for 5 different universities, some of them will only take GCSEs. They won't consider functional skills. They won't consider level 2 in an access course. Mm-hmm. We do. We're as flexible as we can possibly be. So other universities have different rules. So I'm assuming you've applied elsewhere. So then you need to look at what they want from you. What I'm doing is giving you our position. So I am saying we will take your access. We will take your level 2 maths. Your GCSE is fantastic. Will give you further knowledge of learning around maths, and other universities may like it. I'm assuming you've applied elsewhere. So I'm hoping that makes sense. Johnny, you need to go onto the Middlesex website, and if you go onto nursing, you'll see in the bottom right hand corner there's a click thing through there for Dr. Caroline Sargison, and that's me.
Thank you. And then, okay, thank you. It makes sense. I just want to clarify. That's okay. That's done. Thank you. What are the current issues affecting midwifery?
That's up to you to find out. You need to go and do the research on that. And I'm not a midwife, so I can't really help you.
Well, what I would say on that, I'm not a midwife as well, but if you look at what's been happening in the news with midwifery in the last year because of COVID and how things have had to adapt, that's what's happening. How long is the placement for midwifery? Is it similar to the nurses?
Yeah, so the for midwifery, it's a 3-year program. And again, you spend 50% of your time out in clinical practice.
Okay. And do spaces on the course fill up quickly? Yes, they definitely do, as Caroline has already said.
Mm-hmm.
And what else we got? Is midwifery really hard? I'd say all nursing and midwifery programs are all degree courses.
Yeah, I mean it's hard. You're dealing with with real people and real situations, and you've got your academic learning and your clinical placement, you have to be really committed to it. If you think it's going to be hard, then don't do it.
How common is it to be put on a community placement for midwifery?
Absolutely, you have to have community placements within your program, otherwise you won't register as a midwife at the end.
I'm a non-native English speaker. Would you accept functional skills in English level 2?
Yes, we do.
Thank you. And we've already answered the top one. For some reason, I can't get rid of it. I think we've actually answered all the questions.
245 questions, all done.
We will get this recording out to you within the next day or so. It may come later tomorrow. But what I would say is, if you go onto our website, there's lots and lots of information there about applying. We've got lots of support for interviews and personal statements and UCAS, but make your application before the 29th of January for the nursing and midwifery courses. Do you have anything to add to that, Caroline?
No, thank you very much for coming. I wish you all every success. Just be prepared and you'll be fine. Okay, but if you have got any questions, then again, you can use the Unibuddy on our website. But thank you very much for coming.
Perfect. Thank you for joining today.
Thank you. Bye.
Bye. End the meeting.